So today we will discuss about epistaxis. Epistaxis is bleeding from within the nasal cavity, and etiology of nasal epistaxis is like causes of epistaxis. It is can be idiopathic, it can be local cause due to local causes, and it can be general. So in local causes, it can be congenital, it can be trauma due to trauma and due to infection and due to neoplasms. And in general causes, it can be due to hypertension, bleeding disorders, and drugs. Physiological, it can be physiological, liver failure, and exanthematous fever. So in congenital, it can be due to hereditary telangiectasia, trauma due to nose picking, injury to base, uh, nasal surgery, foreign body infection. It can be due to vestibular sinusitis, atrophic sinusitis, rhinosporiodosis, or rhinoscleroma. In neoplasm, it can be due to angiofibroma, hemangioma, inverted papilloma, deviated nasal septum. In general causes, hypertension is there, but and in bleeding disorders, it can be due to hemophilia, leukemia, aplastic anemia. Drugs that cause these symptoms will be aspirin, anticoagulants, salicylates. Physiological causes is cold plus dry climate, high altitude, menstruation, viscerous menstruation, violent exertion, and barotrauma. Now we come to common sites of epistaxis. It is Little's area, and which is present at the anterior inferior part of nasal septum, just above the vestibule. So four arteries anastomose in that area. These are namely ethmoidal, anterior ethmoidal artery, septal branch of spinopalatine artery, septal branch of labial artery, and greater palatine artery. In this picture, we can see these arteries. So, anterior ethmoidal artery, the branches of spinopalatine, septal branch of labial, and greater palatine, which I forgot to mention. So, this one is greater palatine artery. Woodruff's area. Second one is Woodruff's area. This is also a vascular area. It is situated under the posterior end of inferior turbinate and at anastomosis of spinopalatine artery and posterior pharyngeal arch. So posterior epistaxis takes place here, mainly seen in elderly and hypertensives. So, and third one is retrocolumnar vein. It is this vein runs vertically downward behind the columella, crosses the floor of mouth and joins venous plexus on lateral wall of nose. This type of epistaxis mainly caused in young people. Now we come to classification. Classification is there is two types of epistaxis: anterior epistaxis and posterior epistaxis. If we see the differences between these two, anterior epistaxis and posterior epistaxis, we can Determine these on the basis of age, incidence, localization, common site, and common causes and treatment. Age is anti-epistaxis for 18 years, posterior for more than 40 years, affects more than incidence more common, posterior is less common, localization easy difficult. So common site of anterior is Little's area, posterior is Woodruff's, trauma and STN, and here in the retrocolumnar area, the area where mouth is written by mistake, so that is nose. Okay, you can also correct that thing.